here somewhere. Oh, hey. Hi there, everyone. My name is Mark Scrimshire. I'm entrepreneur in residence at NewWave, and also, just as importantly, CMS Blue Button Innovator. So I've been working with CMS for a couple of years. And what it's about is we've been building really a data-driven ecosystem for healthcare consumers, really trying to get you access to your data. And it's been an incredible journey. So let's think about the scale of the problem. 18% of GDP is healthcare, CMS. That's about $3 trillion, and CMS spends about $1 trillion of that. So you can imagine why I went there, as a chance to really change the game. So what I've been working on with Blue Button 2 and the team at NewWave is really this guiding vision. So we set about to build a developer-friendly, standards-based data API that allows you as a beneficiary, as a consumer, to share your data with the applications or services or research programs that you trust. So that's your personal health information, but you are in control of it. That is really a fairly radical innovation in itself. And it's about putting the patient at the center. And so we did this for Medicare fee-for-service beneficiaries. And that's about a $315 billion spend each year that CMS dishes out. And really, we are at the very beginning of the digital transformation in healthcare, right? We are, pre-kindergarten when it comes to digital transformation. And what is really needed, if you look at every other industry, is to empower the consumers. And I'm afraid we've been in the dark. And so this was really an example to the industry to say, we need to do this a different way. We need to empower consumers with data, let them put the data where they want it to go, so it does really cool stuff. And so, who has actually heard of the CMS interoperability rule that came out in February? I see just a handful of hands. Okay, I think I'm safe to say that Blue Button 2.0 is the only API mentioned in those 240 pages that has been held up as an example to every health plan in the country that they ought to follow our lead. So again, really trying to change the game. Why is that important? Well, health plans in this country spend about $850 billion taking care of us. And so if we change the way that they have to interact with you as consumers, everybody wins. So we're really driving consumer empowerment. So what have we done at CMS? We've made available data for 53 million beneficiaries. They're Part A, B, and D. That's basically their hospital claims, their professional claims, their drug claims. And there's 5 years of that history, which is an incredible resource to people like researchers. That actually amounts to over 10 to 12 minutes, 10 to 12 billion records. So the important part of this is, and I sometimes joke that CMS is really good at creating APIs, but they're usually called comma-separated variable files. That's a joke for Excel users, right? We could have set out and built our own, but we didn't. There's this great thing. Who's heard of FHIR, Fast Healthcare Interoperability Resources? Okay, it's the hottest thing in healthcare, pardon the pun. It's a standard, it's a specification out there. And rather than go and build our own, we partnered with the community. We actually helped to define what some of those standard resources look like. And other health plans are already using that for their own purposes. So we know we've given some value to the community already. But we also then leverage things like OAuth 2.0. If you haven't heard of that, you've used it, because if you've got a smartphone and you've shared your cat videos to Facebook, you've used OAuth 2.0 to allow your phone to post those pictures to Facebook. We do the same thing to make it as easy as for a consumer to go, user ID, password, I authorize sharing. That, again, another radical innovation. And what we're doing there is leveraging to the hilt that you, as a consumer, have this HIPAA right of access to your data and to tell a health plan where to send it. And that's what we've leveraged here. And so the authorization that a beneficiary gives is effectively that consent. We make it as simple as that. User ID, password, click a button, data starts being shared. So say we built this with the industry. When we launched the API, we'd actually put it out there for about 6 months beforehand and had input from developers around whether it was working right. Did it follow the standards? So we've really partnered with the industry around this. And it was actually launched at HIMSS by Seema Verma back in 2018. And we have continued to develop this. So what it's really about is it's not about CMS producing some fancy app. It's about opening a data pipe that you as a consumer can now choose what apps you want to do magic with your data. We're not trying to define that, and there's some great stuff happening out there. Medicare Advantage plans that can pull in your data and look at your claims and see what prescription drugs you've been on, and then work out which is the cheapest plan for you. And if ever you've done that on a health plan's website and tried to remember how to type all those drug names, you know that's a pain. And we make it as simple as that user ID, password, I agree to share. And so there's some fascinating things that have been developed. We have about 23 apps in production today that can access that data. We have over 1,100 organizations in our sandbox, which has got a massive synthetic data where they can test. It's an A to Z, sorry the English there, an A to Z of healthcare. Everybody's in there. That actually amounts to about 1,800 developers. We've got to the point our support forums, developers are answering questions for other developers. It's great. I can sit back and watch. It's fabulous. So, also, we at NewWave, we not only built that core, but we also built an app. And we're also making it impact across healthcare. So our implementation guide is used as a base for other health plans to build the same thing. And also Blue Button as an API, the core data system, is now being used on a number of other systems across CMS. So we really are blazing a trail. And with that, I am told to stop, so I will.